Good afternoon, everyone. Welcome to our webinar today, Creating a New Model for Advancing Data Justice. I am Keon Gilbert, fellow at the Brookings Institution in Governance Studies, also associate professor at St. Louis University's College for Public Health and Social Justice. I am joined by Gabriel Sanchez, senior fellow at the Brookings Institution in Governance Studies and professor of political science at the University of New Mexico. Together, we have co-led this work with Camille Bousset, Senior Fellow, Interim Vice President of Governance Studies, and Director of the Race, Prosperity, and Inclusion Initiative. This work has been funded and supported by the Robert Wood Johnson Foundation. And today we'll talk a little bit about our work, this project, and really sort of just trying to understand the premise that has guided our work. Before I forget, if you have questions throughout this webinar, please send your questions to events@brookings.edu, on X using the handle @BrookingsGov with the hashtag #CommunityDataJustice. Please send your questions there. And with that, I'll begin with a brief intro of our project, and then I will turn it over to Gabriel Sanchez to talk a little bit, to start asking questions of our panel, and we'll go from there. Our work begins with the premise that vulnerable populations have lacked full access to opportunities that really allow them to lead in research projects. Many of these projects have included communities in very cursory ways, demonstrating models and perspectives that have tokenized their experiences, expertise, and representation. Many racialized communities, especially lower resource communities, want to lead research about them to generate evidence that really highlights the challenges and assets of their daily experiences. This evidence can assist in the development of policies and programs that really traditional research designs and models don't currently nor historically have supported. These communities have made it very clear that there has to be new models and a different research ecosystem that enables community leadership and engagement. We cannot truly continue to only empower and support large research institutions to guide and control strategies for data governance. To get us closer to identifying new strategies and models for community-led data governance, we structured our work to answer, what are the conditions under which communities can be in greater control of research and data governance more generally, so that they can advance their own public policy or programmatic agendas? With that, I want to briefly introduce our panelists who will help us explore some of these questions and talk about their individual work as a way of understanding how we can develop a new model for data governance to advance data justice. We have with us Kareem Watson, Chief Engagement Officer of the All of Us Research Program at the National Institutes of Health. We also are joined by Stephanie Shipp, Professor of the Biocomplexity Institute at the University of Virginia. And we also have Adrián Pedroza, National Executive Director of Abriendo Puertas, Opening Doors. With that, I will turn it over to Gabe Sanchez.
Thank you, Dr. Gilbert. Appreciate the overview that you provided of our work, and I'm really looking forward to having a great conversation with our panelists about the lessons learned. I will say at the onset, before we jump into the questions, that each of our speakers has been along with us through this journey, participated in a number of joint discussions with other experts focused on data governance and oversight. And many of these folks have also participated in one-on-one interviews. So their wealth of knowledge has contributed to the research that we've done to this point that Dr. Gilbert noted. And part of this is essentially summarizing their experiences along this journey with us. So without further ado, I'm going to jump right into this. And just remind audience members, as we're going through the panel discussion, if you'd like to send the panel any direct questions, remember you can do that at brookings.gov if you want to use X, or you can send an email to events@brookings.edu if you have any questions. I will field those on behalf of the panel and try to get as many of those in towards the tail end of our discussion as humanly possible. So without further ado, let's get things kicked off. Our first question probably will give you a little bit of an opportunity to share your overall thoughts before we get into more specific questions. As you all know, our research for this project suggested that there has been pretty significant advancements in community engaged research that provides more power to communities, specifically in the area of data governance and data justice. For our first question, please, based on your perceptions, as researchers in this space, as leaders in this space, give us an idea of where we are with data justice across the country as you see it. What have been some of the biggest advancements made, and where do you see that there's more work for us to do? We'll go ahead and start with you, Stephanie.
Thank you, Gabe. So where are we? Well, when we started our social and decision analytics division or lab, we were located in Arlington, Virginia, and we were purposely placed there even though our institute is located in Charlottesville. The reason for that was that the Biocomplexity Institute wanted us to work with local, state, and federal government officials to bring data science to Virginia and across the nation. Where were we? We thought that when we started in 2013 that we would be working with megacities. And then we stepped outside our front door, and the reason I took so long to say where we were located in Arlington, and we met with the fire chief and the chief information officer and the housing director, we realized there was a huge need for what we would at the time call big data, and now we call it data science and data justice and governance, a huge need in these smaller and mid-sized counties. And then as our work expanded and we had a 3-state pilot to focus on economic mobility, the 3 states were Virginia, Iowa, and Oregon, we worked with dozens of these smaller towns, the smaller cities and rural areas, and they are all equally hungry as are the large cities. Large cities adopted data science right from the beginning. You know, they have their data analytics groups. Now you see some mid-sized counties beginning to do that, but there are still just so many areas across the country that are hungry for this, but don't have the resources or the wherewithal. And so funding through grants, through foundations is really critical. We have a community learning through data-driven discovery process, and what we like to think is unique about it, although I think that it is true of many community-based approaches, is that we work hand in hand with the community. They ask the questions and they participate in the research. Our entry point is often the local civil servants, and then we do further outreach through the community, through community conversations, but those are targeted toward what issues we're focused on so that we ensure that we get that feedback. This process works, and we have a lot of examples to show that it works.
Thank you. That's wonderful. I think you already can tell why we've got the right people in the room to have this conversation. Thank you, Stephanie. How about Mr. Watson? Why don't we move to you next? Same question. Where are we at? What's going well, and where do we see holes that need to be addressed?
Thank you for that, Gabriel. Well, where we are, particularly with our program, we're the All of Us research program. We are one of the largest and most diverse genomic data sets in the country. When we think about large data and big data, we now have over 700,000 participants who began their journey with us, and over 500,000 participants whose data we can actually analyze to really begin to interrogate some health disparities. But when you think about that data size and what it took for us, and also 80% of our participants are what we call underrepresented biomedical research. That means from groups who have been historically underrepresented: sexual and gender minorities, racial and ethnic minoritized populations, people living in rural communities, even those with lower SES. So it was important for us to create a data governance model that really democratized not just us collecting data from diverse groups, but to create opportunities for those who we've collected the data from to actually have a say-so in how that data would be utilized. So we have a data governance model that we developed in conjunction with Dr. Consuelo Wilkins at Vanderbilt University, where we actually have participants in governance. And we've talked about how we place our participants on our ancillary studies boards, where they're actually reviewing what studies will come out from our data. They're actually sitting in our IRBs. They're actually sitting in our survey development places. So participants are actually sitting in places that can help determine how their data will be utilized. But another place of data governance we talk about that we don't talk enough about is in terms of who's the researchers analyzing the data. We know that there is stark inequities across our historically Black colleges and universities, at our Hispanic serving institutions, and at other minority serving institutions when it comes to resources and how they have big computing, the use of AI, the use of machine learning to analyze that data. So we've partnered with organizations like Community Campus Partnerships for Health, CCPH, and even RTI, Research Triangle Institute, to do some upstream capacity building, to build capacity for our HBCU faculty, even things like buying out their teaching time. Because we know that if you're not a Research One institution, that your major job may be teaching. And so we've thought about all those things when we think about data justice, even to work with partners like the NHGRI. And the last thing I'll say, Gabriel, and where I've seen some movement in this place is across the other government agencies like the Common Fund. We now have awards going directly to community. That's a game changer. Not awards going to big academic medical institutions, but awards going directly to community. It's things that we saw for years in places like PCORI, the Patient Centered Outcome Research Institute. So we are seeing a change in participants in governance, participants having a say-so in how their data is used. We're seeing B, a change in who's analyzing that data, and even C, seeing a change in where those resources are being given to, but we still have a lot more work to go.
No, I greatly appreciate that, especially having some very concrete examples of how we can formalize the role of community in the research enterprise. And one thing I'll hit on, because it was something that we heard consistently across a wide range of interviews for the project, descriptive representation came up again and again at all aspects of the data oversight and management enterprise. And in short, we heard from folks that it's great to see a greater number of researchers that are embracing these principles, but it's not so great that we don't see a lot of folks that are from these communities leading the effort. And I'll say that's not just in terms of researchers, but we heard whether it's the translation side of it and working with media partners, whether it's working with folks that make sure that the data gets in the hands of policymakers. We heard over and over again that the work left to be done is identifying and uplifting folks that actually come from these diverse communities in every step of the process. So I appreciate that comment. Last, definitely not least on this question, Mr. Pedraza.
Yes, thank you, Gabe. A lot of great points have been made by my fellow panelists. Abriendo Puertas, Opening Doors works in the early childhood space around parent and caregiver leadership, and we get to work in 42 states with implementing partners that are on the ground, really serving communities and families. What we're seeing is there's a strong concerted effort across the country to center community and family voices analysis and research. We really see this as a form of building power and data justice because we're able to hear directly from those communities that are impacted by the data and the research that we're reporting. We've also seen more partnerships between research institutions and community-based organizations as there seems to be more interest in applied research initiatives that really inform research to action. And that's a big area of interest for many of the groups we work with, is to ensure that the research they're participating in, the data justice work is actually leading to everyday changes, right, in their communities that they're able to see. We know that we're seeing that technology is allowing for more ongoing, right, surveying and participation from wider audiences, and in that is making it more reflective of community needs. However, I think there's more work to do around ensuring that the data collection, the research, is not done in a passive way, that we are really truly investing in community leadership, that we're seeing communities and families as co-researchers, as has been said by some of the panelists. And there's really work to do around really seeing community members as co-researchers and investing in their training, development, and the processes, right? It's resource intensive. I've been a part of many of these efforts, and they're beautiful when they happen, right? There's a lot of capacity that's built. There's longevity, right, in the ongoing work that follows the research, but it is resource intensive, and it really takes a strong partnership between our research institution, our community-based organizations, and to have good brokers, right, in place that are navigating IRB processes to ensure that burden isn't put on community-based organizations and the families that are participating. One more thing on more work that needs to be done is really taking assets and strengths-based approach to our data and our research. So there's so much that we have to learn around what's working well within our communities. Many times I think we look at the challenges and the negatives that should be highlighted, that we should address and face those brutal realities. However, we are seeing families thrive despite systemic and institutional barriers that they face, and we need to do more work around highlighting those assets and what's working in our communities.
Thank you, Adrian. Very well stated. I'll add a couple of points of emphasis on points that were raised. One is we collectively heard from researchers that to do this type of work well and give communities more oversight and power, it takes longer than more traditional research, right? So as Adrian noted, it's often labor intensive. I recall Stephanie yourself telling me that part of the process of getting to know the community partners just takes time before you even start talking about the research. And so one of the big principal points that we've made in this research project is working more closely with funders to make sure that they understand the timeline needed to do this type of work, and to do it well often takes longer than the typical start and end dates of most grant funded projects. So I think that's an important point of more work to be done in that space to allow all of us to do the important work that often takes a little bit more time than traditional research. And then second, it's a basic point that Adrian made, but I think it's an important one to elevate. Oftentimes, and I know as a researcher in this space, I've been part of this many times that I care more than to admit. You do some great research, involves a large base of the community, and then those findings never actually make them way back to the actual community members that participated in the effort. So a very obvious but important point to make for all of us engaged in this research is making sure at the end of the day, we report out the lessons learned and the findings to the participants from the community that invested their time and energy in the process. Keon, I know you had something that you wanted to add to this point of the conversation before I transition to the next question.
Yeah, so I actually wanted to ask the panelists to just talk a little bit about what it's like, what strategies they've used engaging multiple stakeholders, especially across different geographic boundaries, also even thinking about partners and stakeholders that are in different sectors. We've got a lot of people who are likely listening or will listen to this who are at a very early stage of thinking about this type of work. And, picking up from Gabe's comment about sustainability, it can be difficult in lots of ways. It can be difficult in managing the partnerships and relationships, and also difficult in sort of managing those timelines to getting to sort of either thinking about processes or thinking about different types of outcomes. So if you could talk a little bit about managing different stakeholders and partnerships and across sectors and different kinds of boundaries. I'll start with Kareem.
Thank you, Dr. Gilbert. Well, that is such a great question. I'm actually going to speak from my years in the academy, spending 17 years at the University of Illinois at Chicago. And like Dr. Gilbert, we met because we both did community-based participatory research. It took me 5 years to build a partnership with one of my community-based organizations, Project Brotherhood, that was on the South Side of Chicago working with African-American men. And even when you talk about that multi-stakeholder, multi-partnership engagement, Dr. Gilbert, one of the things that we did, we had to understand that we had to do a lot of pre-work ahead of time so that there could be equity in that relationship. Even the way that community-based organizations get a subaward or get awarded through an academic partner, we had to address a lot of those inequities. There was inequities in indirects. We even had to have a conversation about what indirects meant to a community-based organization versus what indirects meant to us as an academic partner, and even in that language. And then we worked with barbers as well. So as academics, our days are often 8 a.m. to 5 p.m. So we hope, right? When we think about barbers, when that's time when they're working, and it's often the weekends and often Mondays that they had off. So it was what we learned is that we had to address those inequities upstream, work with the barbers to say, when is the best time for us to engage you? How do we get you a vendor ID so you can get paid appropriately and on time? Even teaching those barbers about thinking about forming things like 501c3s so they could come together and become their own community-based organizations. And then just looking at the inequity in the type of research that I did as a CBPR faculty, it may take me almost 3 to 4 years to publish a paper based on doing that work with the community partner. Whereas my other colleagues that were in basic sciences could publish their papers within months after collecting their data. So it was just those little inequities in multiple partnerships, and even understanding that communities don't work that 9 to 5 that we do. And they often do this on top of that. And the last thing I'll say, Dr. Gilbert, we even had to realize that we needed to compensate our community partners as a different type of stakeholder, even for attending the meetings. As a faculty in the planning meetings, when I attended those meetings, that was a part of my job. So I was getting compensated for that. But But every time we asked one of our community partners or community stakeholder to attend a meeting, what seemed to be the right thing to do to co-create and co-plan with them, if you're doing these meetings before the grant, before funds are there, they're doing this on their own time and on their own dime. So just what we determined was thinking consciously about the systemic inequities and how they will show up, not they might show up, but how they will show up on the hands, particularly of community partners, and how to put things in place within our system to try to mitigate those inequities.
Great, thank you. Adrian or Stephanie, would you like to add before we move on?
Yeah, I'll just add a great points made. I'll just add, and Gabe alluded to this, that the funders, whoever's funding, right, this research project is in it for the long haul, it's in it to completion, right? Because it's been, as been stated, there will be challenges, right? The process will take, many times longer. There's trust to be built, as was said by Stephanie. And so needing to make sure that the funder understands that up front. And then also that we understand what the end game is, what the goal is for this, and that's really co-created with community, right? I've worked on projects where we were working with graduate students that the project turned into their dissertation. The community members knew that this was going to be part of the end goal, but the community members also wanted to own part of the IP, right, that came out of it. And so they owned actually part of the social emotional curriculum that was developed with their support, and they were actually able to implement it and use it with community members afterwards. So that was agreed upon at the beginning, right? Agreements were made at the beginning. And so that way there was no question as they were going through this research project of what the end product was going to be and how life was going to be brought to this research project after the process.
Great, thank you. Gabe?
I'll add a little
bit. Do you have anything on this question?
I do. And we work at the county level, so maybe it's a little bit different. And once a county has sort of accepted that we're working with them, the data sharing agreements are usually very easy to put in place. In Arlington, they did a county-wide data sharing agreement. Fairfax actually doesn't require any. In other counties, they have moved rapidly because they're able to, or they have this strong desire to work with us. And sometimes speed is of the essence, even though upfront it takes a long time to create those relationships. But what we find works best is to have a community champion. So for us, it's often the data-wide county data coordinator, or it's the chief data scientist, or whatever the title is of the person in that county, because they're the ones who also have the trust, and they can make introductions or connections and help us forge those partnerships so that once we do start a project, we can hit that, start with sort of hit the ground running, so to speak. What's helped us is also having infrastructure in place. So that is, we begin to accumulate data. It goes into what we call a data commons. A lot of our reports and our results and the actual raw data go in there, so the county can begin to explore those data as well. And then somebody said that, well, we have to remember to give that report at the end, but our model is that we interact at every stage of the way. So we meet weekly or biweekly, or sometimes a little more infrequently monthly, but we're producing results, but we're not waiting till the end to put them in a report to get feedback. They're seeing those results. And oftentimes our report will end up being a slide deck just because that's more useful to them, that's been annotated. And we get stuck sometimes on the results. We don't understand perhaps why 911 calls have gone down when the population's increased. Well, the population that's increased is all young. So the community quickly can look at data and have aha moments when they see results that either confirm what they know or provide new insights. So I think going back, just to close, for us, it's having a community champion that helps sort of pave the way, so to speak. And that's where a lot of our relationship building starts.
Excellent. Great conversation already to be had. So I'm going to transition us to the next question. And often, I think as we've gone about this research, many of you experts on our panel would always start with, so what's the end goal here? What are you folks looking to see as the next generation, if you think about it that way, and kind of this data justice enterprise? And I think we've always thought about it in terms of pushing in the relationships between researchers, funders, other power brokers, and community to have that balance of power, if you think about it this way, 50% or greater with communities. Unfortunately, neither our landscape analysis or interviews with experts can identify any example of a relationship where the community actually had the balance of power 50+%. So with our next question, I want to ask you folks to think deeply about this. Do you think it's feasible or possible to reach a goal of having communities truly hold the balance of power in data governance relationships? And if so, what do you think has to happen for us to collectively reach that goal of 50% or greater power with communities? Adrian, we left you batting cleanup last time, so how about we start with you with this question, then we'll move to Stephanie and then Kareem.
Yeah, that's a great question and a difficult question to answer, right? I think there are a lot of important pieces to this at both the institutional, research side of things as well as the community side of things. I'll say from our perspective, what we often hear from community groups that we work with and the families is that we really need to listen deeply to what families and communities how they want to participate, right? How they want to own the process, and then the results, right? The next steps, the solutions that maybe follow. And that's kind of a broad statement, but just to hone in a little bit more, I've worked on projects where ownership looked like parents and community members wanting to serve on an advisory, right, boards once the data research was collected to help kind of shape, right, the project as it moved forward into the maybe action phase. I've worked on community-based participatory research projects where community members actually formed a cooperative, right, where they owned some of the relationships that were developed, right, through that research project, and were actually able to create contract work and part-time jobs for immigrant family members who to advise institutions on other data research projects and to be a part of other research projects as co-researchers and develop curriculum and different things. So they created an entity and then owned kind of that. So I think is really allowing, right, these different levels of participation, of ownership. Family members, community members are many times busy with their full-time jobs. They're doing this in the evenings or on weekends. Some of them might be able to take time during the day, but to really allow a flexible process for community members to define what that ownership looks like, and both during the process as well as the follow-up and the action items that follow. I'll pause there.
Excellent, thank you, Adrian. Stephanie, any insights on reaching this 50% or greater power with communities? Need to unmute yourself, Dr. Shipp.
Sorry about that. I do have a note here. I like to think about it being more meeting the county where they are. And so early on, they often don't have that experience. But as I said, if we have a community champion and then we have a community team, even if that team is small, it can be powerful. And that balance can sort of ebb and flow, but we don't do any of the work without them. I mean, they work with us to create what questions we're answering through the data. We share those results all the way along, and they help provide insights. And then at the end, those conclusions and policy analysis. But we have two examples where this really worked well. In fact, in both examples, these counties came to us because they had concerns or a data issue that they wanted to address. So they were super motivated. The first one was in Patrick County, Virginia. And the local public health official was brought together. She came to us and she said, we lost our last hospital. We're really concerned about healthcare access for our population in Patrick County, which is rural, but not very densely populated. And she put together a team with her local cooperative extension, which is something that we propose a lot of these teams have, as well as the local fire EMS person. And the first thing they just wanted was a dashboard. They wanted to understand the data, and we created lots of maps and put together lots of data. But what emerged out of that was that we found that almost 3/4 of the population live within a 12-minute drive of a fire EMS station. So once they understood like access to services such as doctor's offices or clinics or even grocery stores or other services, and the fact that most of the population lives so close to fire EMS stations, they immediately set out to secure funding to set up telehealth visits with doctors and specialists at these fire EMS stations. So that was amazing. Within sort of this 10 or 12-week project that we had with them, they actually achieved an outcome. A similar thing happened in Marshalltown, Iowa. I'll be briefer, but same thing. They brought together their transportation specialists, cooperative extension, and the community to find out why the bus routes weren't working. And through a lot of data analysis, they improved their bus routes and achieved an over 10% greater increase in ridership and won several federal, state, and awards. So those are two examples that were very successful because the community really was involved and actually took action based on the data results that we presented to them. But for our model, they have to work with us. Otherwise, it doesn't work. They have to be invested in it. But achieving that, of course, is what takes time and relationship building.
Excellent. Thank you for that. Just putting a sharp tooth on the point of meet communities where they're at and great outcomes happen, right? I think that's the take-home message from what you're hearing across the board. Kareem, any insights on this particular question, helping ensure that we get to 50% or more in power relationships with community partners, and what do we need to do to get there?
Thank you, Gabriel. And I'm going to build on what Stephanie said in meeting communities where they're at, but I'm going to speak on the side of how even the funding announcements are written. We have to do more work to ensure that the funding announcements are written in a way that allow for that to happen. And again, I highlighted these two before, but when the funding announcement highlights and elevates and said, we want to see community in the driving seat, we want to see 50% of the budget or more go to community. When that happens in the RFA, academics, many of us that do community-based engagement work, we want that. And we can then take that to our institutions and say, this budget must be co-developed where half of this goes to the community partner. Again, to reiterate what I said before, we saw that in the Common Fund, where there was a particular grant that came out of the NIH called the Common Fund, where the primary applicant had to be a community-based organization, not an academic partner. That was a game changer. We see that in the Eugene Washington PCORI Engagement Awards, where you have to have a community member and you have to walk through how the budget will be equitably given to those community members. But Gabriel, there's an upstream thing that needs to happen, that we have to do an asset and needs assessment of our community partners to see, will they be able to be an equitable player? Do they have the budgetary resources within their organization to handle a grant of its size? Some RFAs require that you have an operating budget of a minimum amount that community-based organizations don't have. So how can we partner them with a fiscal agent that's also another community-based organization that can be their partner? Community office and technical assistance. We hold technical assistance several times way leading up to grants, RFAs OTA applications that we put out, because we want to make sure that community members have time to ask us, what should they be thinking about in putting this grant together so that that community member can truly be in the driving seat. And so those are some of the things, and I'll end with another concrete example. There was a researcher in the Detroit area out of Wayne State University, Dr. Haley Thompson, who actually had a PCORI engagement grant, but put things in place so that that community, at the end of that grant, they applied to become a not-for-profit organization. So the work that she started doing in that PCORI engagement grant could continue after the life cycle of that grant was over. There's some examples out there, but we need more.
Excellent discussion. I'll highlight a couple of points that you made, Mr. Watson, that came across the overall landscape work that we did, and we just heard over and over again from experts in the field. And one of those is that funders have an awful lot of power to move communities in this power relationship above the 50% threshold. And you noted that, how the RFA or the RFP is structured, right, pushes us as researchers sometimes to pursue community having more power, because at the end of the day, we want that, as you noted, and we know that it's going to increase our likelihood of getting funding to do this great work. But the key is, and this was emphasized in a lot of the interviews that we had, in order for communities to actually take ownership of that power, and something as basic as being the home to the grant and having oversight of all budgetary decisions, we cannot assume that they have the capacity in-house to tackle that. And so making sure that in the context of thinking about funding, we also invest in the infrastructure of community-based organizations and nonprofits so they have the capacity to oversee those grants, including the evaluation which is often part of the RFA. So that infrastructure needs to be built in order for communities to actually own that power that we think we all want to collectively move them towards. So with that, I'm going to pause just to remind everybody in the audience. I'm seeing audience questions starting to stream my way. We appreciate that. For those of you that have questions, remember you've got 2 opportunities to send those in. You can either email us at events@brookings.edu, or for social media users, you can use X, formerly Twitter, at BrookingsGov, and please use the hashtag #CommunityDataJustice. There's still time to get those questions in. We've got one more panel question, and then we're going to transition to the questions from you folks at the audience. So send those in again to us to make sure that we can get to them. So with our final question that I have for you before we open things up to the audience, so far we've had a wonderful conversation that somewhat assumed that by providing more power to communities over decisions regarding how data is collected, how it's analyzed, for what purposes it will be utilized to advance policy, etc., we've somewhat assumed that by going down this path, we'll actually see less inequalities facing communities across a range of social policy issues, right? I never like to make assumptions. So I want to make sure that before we transition to audience questions, I want to pose this to you directly. Do you believe at the end of the day that by empowering communities to take more control over data and research, will we actually move needles in terms of inequalities? And you can think about those inequalities from a range of different perspectives, whether that be race, ethnicity, gender, socioeconomic status. I know all of you work in different spheres, so feel free to take this question in the direction that you would like to. Kareem, I believe we'll start with you, then we'll move to Adrian and then Stefan.
Thank you, Gabriel. I want to actually frame this as an and conversation. I think there's definite need to move data democracy with community being an equitable partner. But I do think that there is benefit in community academic partnerships, especially when it comes to intervention development. So I remember when I was working on my dissertation, looking at a community health worker model for cervical cancer screening in a global setting. It was a community health worker that told me, Kareem, your intervention will not work unless you ground some of the education of what you're doing with the staff in a faith-based context. You're missing a whole community element of a faith-based approach. So it was me listening to that community health worker and implementing what she said into the work that we were doing that led to some intervention. So as a researcher and as an academic, hopefully we deal with interventions. So I think it's an and, Gabriel. I think it's making it an equitable partnership. I don't see right now that the part of the moving the health disparity needle will only sit on side of the community or will only sit on side of the academics or even our government or other community-based organizations. I think it has to sit at that intersectionality of team science. That's where I think we've been too inequitable, is that one side of the power structure usually sits on the side of the ivory tower researcher. And therefore, community is usually an afterthought or just an advisory board member and truly not driving that work. And I know firsthand that when I was doing work on prostate cancer screening on the south side of Chicago, we were able to move the needle in that health disparities by working directly with the community-based organizations, by working directly with the barbers and the fraternity leaders in that community that allowed us to recruit the population that we needed. So the data that could be analyzed actually showed that had we relied on previously scientific data that was collected, where the majority of those participants were not African Americans or not Hispanic or Latino men that carry the greatest burden of disease, we would miss a certain percentage of dangerous prostate cancers. That work was done and was powerful and moved the needle because it was done with communities, for communities, with academic partners in an equitable way. So I think it's an and we get to.
Excellent, well stated. Always have to have that and, right? So we're not limiting, right, any of our collective goals at this point where we're really brainstorming what we would like the future to look like, right? I think we should be as broad and ambitious as possible. Excellent. Adrian.
Yeah, I agree that really when we ensure that the work is done at the intersection of institutions, community, power brokers, policymakers, that we will really see things shift in equities. And in the end, in my point of view, families and community really need to see their daily lives impacted by the projects that they're involved with, right? That it's motivating for them to want to be engaged in something that they're going to see impact, right, and improve their daily lives. And I'll give you an example of this. So in New Mexico, there was a big effort 15 years ago to really improve our early childhood system, right? Unfortunately, New Mexico many times is last place in child well-being and many indicators. So funders were interested in learning why maybe families weren't accessing childcare in their communities. So we engaged in a community-based participatory research project with the University of New Mexico, community members as co-researchers. And community members went out and interviewed family members, parents around why they weren't accessing childcare. The assumption was that they didn't, that they didn't want, that they couldn't access a childcare center because of maybe cost or trust. And some of those things were true, but what the community co-researchers found out is that they actually were using childcare, but they were using home-based friends and families and neighbors childcare. And so this spurred an additional question. Well, why are our home-based providers off of our radar as an early childhood system? And so there was some follow-up research that was done to better understand the home-based provider sector and why they weren't a part of our formal early childhood system. Community members were a big part of not only designing this research question, collecting the data, doing the interviews, but also that led to a lot of work that followed to shape an early childhood system in New Mexico that really funded, provided support, technical support, that credentialed and helped our home-based provider and our friends, families, and neighbors providers to be a part of the early childhood system, fundamentally really changing the way, right, that home-based childcare providers were able to participate and to even be compensated, right, by our state subsidy program. And so that's an example of how when we saw this intersection happen, right, policymakers being at the table, institutional leaders, community members informing the process, being involved in the process, that we saw things shift, that we saw really things change at the community level, at the systemic level, that really allowed a better, more informed early childhood system and led to a bunch of other victories in the early childhood sector in New Mexico.
Excellent example, Adrian. I was blessed to be part of that effort once upon a time here in my home state of New Mexico. And I will point to, because this question basically asks, right, are outcomes going to improve if we, expand community capacity and ownership? And we have highlighted here at Brookings the work you have done collectively with a lot of other community partners to have New Mexico be one of, if not the leader in early childhood funding and building out the infrastructure to service families in the state of New Mexico. That's an excellent example. Stephanie, last on this particular question, and again, for folks in the audience, right, we don't want to make an assumption that outcomes and inequalities will actually improve with improvements in community oversight and data power. Stephanie, any thoughts on this one? Still got to unmute yourself.
I do, and I was doing it in the wrong place. Sorry about that. I think Kareem and Adrian already eloquently said this, but part of working with a community is the learning and the education and the capacity building that occurs over that life cycle of the democratization of data. So communities, at first, when you work with them, they don't even realize they can ask these questions because they're so used to getting prepared reports and that's all the data they have. And then all of a sudden they have this wealth of data in front of them that answers questions that they have. So I think learning to ask questions and not just accepting the status quo, that's sort of early in that learning cycle, and then building their capacity to actually use these findings in a way that informs their policymaking and their decision-making. We liked when we worked with the firefighter, he would talk about, well, that helped me improve my situational awareness. That helped me improve my strategic planning. And that helped me improve my anticipatory or unintended events that might have happened. And so sometimes even thinking about how you structure what is the kind of question that's being asked and how will this help help the community at large. We also have been working with Fairfax County, and they asked us to do a study on the status of women and girls in Fairfax County. And out of that, through our community conversations and data analysis, we also discovered that childcare was really the linchpin to a lot of the issues and challenges and problems. But it's a two-sided coin, because the childcare providers also are not very well paid. So you have a problem on both sides. And working not only with the women, the community conversations with women in the community, as well as with the local government officials, as that we're passionate about working on this. The proposal to the Board of Supervisors is to consider making childcare on both sides part of the education system. So you begin to professionalize it, but then you have to balance that by providing subsidies to families to be able to afford the childcare as well. And we had several recommendations that were gained both through conversations with the community, but this became a unifying topic that really led to how could you improve the status of women and girls in Fairfax County? It seemed childcare, elder care, and professionalizing those occupations, as well as enhancing benefits to families, to have that became sort of an issue that everybody could rally around. I will have to add that longer term funding for this kind of community-based research is also important. We receive a lot of funding to do prototypes or a pilot, and then it ends. And so I think also a plea to foundations and grant providers is that they have to look at a longer run timescale for this. It can be very frustrating to get to this point, prove it successful, and then it stops.
That's an excellent point to end with, because I think all of us as researchers have been there in our careers where you're just starting to see the fruits of the collective labor, and then it's transition away from funding and trying to explain to the community why that happened. So I think making sure, if the end game, right, is addressing inequalities that are stark and have been built over generations, we have to remind ourselves we're not going to solve that in a 3 to 5 year grant. It's got to be a long haul investment that I think you've heard from all of our panelists know. So this is a beautiful thing. You all have actually been concise and really on point with your answers, which leaves us right on schedule to get to the audience Q&A as we'd hoped for. So I appreciate all of you, not only for embarking on your wisdom and sharing that with us, but doing so in a succinct enough way to make sure that we have plenty of time for audience questions. So with that, I'll start things off. I appreciate audience for sending in a good number of positive questions that we can turn to. I'll start with the first one. Keon, please feel free to add any follow-ups if you feel that it's needed as we start this conversation. I think this question's a great one that comes from Caitlin Levinson from Route 50. She's an assistant editor there. And it hits on a theme that you've already heard collectively across our conversation on trust. Her question notes that, considering that there's historic mistrust and very low trust levels between the community and academic institutions, between communities and government that often funds this research, and let's be honest, sometimes between communities and us as individual researchers, her question is, how does this style of research and increasing community power over decisions over data, how can this framework help governments move forward with improving and restoring trust with communities? And I'll add, beyond governments, if that's all right with you, Caitlin, also funders and researchers. In essence, how can doing all this work that we've laid out actually improve trust dynamics, which we know is so important for this research to begin with? Any of our panelists, I don't want to call it anybody in particular. If anybody feels like this question speaks to them, feel free to unmute yourself and jump right in.
It said government, so I'll jump right in first, and I'll be brief. But I think I want to add one thing to Caitlin's comment, if I may. It said, considering the historic mistrust, I always like to say justified mistrust, right? That mistrust is justified. And I actually don't tell my peers, let's try to make the community trust us. Let's work on letting the community trust us. We actually work on internally becoming more trustworthy, right? Because that's the bidirectionality on it. And so having community trust you, and we know it takes years for that to happen, we need to appear more trustworthy. A concrete example for us and how democratizing data and getting to more equitable power dynamics between community happened with our work that we're doing in the All of Us research program and at Tuskegee University in Macon County. We had to address firsthand the historical misgivings that happened through the United States Public Health Service study of untreated syphilis in the African American male. The reason why I say the full name of that study and don't call it the Tuskegee experiment is because when we went down to the community and had a series of listening sessions and roundtables, they said, we don't like when people call it the Tuskegee experiment because it puts a negative connotation on the community and it doesn't put the onus of where the injustices actually happen. When we went down to Tuskegee University and Macon County to have these conversations, we knew that we could not come in and have one conversation and leave. We actually left resources with 3 community-based organizations in that county to have the 5 years of engaging with partners in Macon County for building trust for them to see us as more trustworthy. We finally, after finding 5 years, community members have said, now you've shown us that we are ready to have a real conversation with you. Now we want to talk to you about how you can come into our community under our guidelines and have informed true partnerships. That took 5 years. It took us planning resources in that community. And lastly, it took us having an accountability statement and saying, we understand why you don't always trust government. There's a historical precedence for that.
Excellent. And any of our other panelists want to jump in on this question regarding trust?
Well, I know that early on we met with the Department of Social Services in a county in Southwest Virginia, and we thought we were pretty prepared. We had talked to several nonprofit organizations and we had talked to many of the people in the community, but we hadn't talked to him before the formal meeting. And we started our presentation and he took one look at us and he just said, "Oh, you're the researchers who just take my data and I never see you again." And we're like, we tried to say, we hope we're not those researchers and that's not our model, but we knew that we had lost that fight. And because he had had such bad experiences with that. So it's not just lack of trust with the government, it can be lack of trust with university researchers and really build. So you have to build that model. So we do have, and I've mentioned this, a proposal that cooperative extension service professionals they are the boots on the ground. They're in every county and city across the United States. They are a trusted network because they work with the community. And so we're proposing a data science core within the cooperative extension. And we've discussed this idea and even tested it in a 3-state pilot, and we've shown that it works. So when we're talking about how do you scale community-based participatory research, or in our case, our community learning through data-driven discovery model, we think that one entree, and an important entree, is through cooperative extension, because they are that trusted network in the community. And so that can initially, especially if you don't know a community, they're your champion or can be your champion. And so we have proposals that we've submitted. We've socialized it with USDA and on Capitol Hill and with many, many other groups, including cooperative extension across the country. So we think at some point there will be one of the ways to scale this model over.
Excellent. I love it. Great wisdom so far, thinking about this really important dimension of trust. Adrian, anything that hasn't been covered that you might want to chat about on this question?
Nothing else to add. Very well said. Yep.
Excellent. I know, Keon, you've been looking to get a follow-up question in, and I think this fits really nicely with the narrative that we had, so go for it.
Yeah, so we received a number of questions covering and thinking about capacity in a lot of different ways. And you've given some examples. Kareem, you've talked about the capacity a little bit of some of the work that you're doing at HBCUs, some capacity that has been built at NIH to be able to fund community-based organizations directly. Adrian, you talked a little bit about it from the community side, working with families. Stephanie also talking about it with working with different government agencies. So if we were to sort of peel back some of the layers of the work that has happened to get you to some of these examples that you've talked about, what have been some important pieces or elements of putting that together in terms of ways that they could support a data justice infrastructure for either community-based organizations, government? We've talked a little bit about funders and even about academic institutions. So I'll leave it up to you to give an example. Adrian, I'll start with you.
Yeah, I think a user-friendly process, right, for community members, user-friendly from the data collection side. I've been involved in IRB processes where we had great brokers, within an educational institution that made it a very user-friendly for community to be IRB approved, right? Data collectors and researchers, and went through a community-friendly training. So, user-friendly for me, is really right important. I would also add that, as we look at, and Kareem, talked a little bit about this, about how we're investing in that infrastructure and community, right, that is going to build capacity that is there to stay, right? And I think Kareem talked about forming nonprofit entities. I've seen, as I mentioned, cooperatives formed, business entities, right, be formed out of that, right, for some economic, right, benefits to community that outlive that research project. So how we can build that capacity, right, that will live in the community beyond that research partner process is very important. So there's the infrastructure and the actual process, and then there's the infrastructure, right, in that capacity, and the tools building, the skills building, the structures, right, that we create in community. And that's what I love to see. I mean, some of these structures that I've been a part of, seeing, still live, 10, 15 years later, and they're still working, right, on that issue, right, in different ways, and with different clients or different partners. But that, I think, shows that when we invest in leadership of community, right, and those infrastructures, that we will get those results, right, tenfold and beyond any given funder timeline that they might that they might have for that specific project.
Thank you. I'll turn to Kareem. You want to add anything?
I think Adrian hit on it for sure. It's that capacity building. And again, it's creating space for it. And Stephanie even talked about this. We need to think about that year one of that grant sometimes being just for capacity building, and maybe that year 5 of that grant being about sustainability and dissemination, right? How do we think about those things intentionally? But they cannot be afterthoughts. That's what I'll add to this in this brief period of time.
Excellent. Stephanie, anything to add to this conversation?
I'll just repeat a little bit of what I had said, is having that champion, whether it's the firefighter in Arlington County, or the countywide data coordinator in Fairfax, or the cooperative extension in rural or other areas that you may not know as well. I think starting with that trusted champion who can then introduce you is important as well.
Wonderful. As I look up at the clock, wow, time flies when you're having fun. So we're coming to the end of this program. I'd like to thank our panelists for being outstanding throughout the full entire process. I know that they've been with us for the full ride on this project. We appreciate all of your wisdom, your thoughts. Thank you to the audience for being wonderful. Those of you that were able to submit questions. I want to point out that our team likes to take our own advice. We said always, when you're working with communities, you want to report back out to what we found. So look to this events page. It'll be probably the last day of this month. We will have our full report and some other support materials available for all of you to check out, see what we've learned. Feel free to email any of our team if you have any follow-up questions after you get to take a look at those materials. In closing, the last 2 questions that I took a look at basically allow me to talk a little bit about the next steps. This question basically said, what resources could be made available to either researchers, state governments, county governments that would like to pursue this path, but maybe do not have the tools or the infrastructure. You've heard that word infrastructure noted often, to be able to actually implement all this great wisdom that we've heard today from our panelists. And I'll say part of our next steps, and this will be a conversation with our great partner, the Robert Wood Johnson Foundation, and our team about what those next steps may look like. One of the ideas that have bubbled up through the research and from the experts that we've heard through this full process is building out a toolkit that could essentially be utilized for both community entities, nonprofit organizations, CBOs, researchers, as well as media partners and state and local governments, to provide them with resources, whether it's examples of RFAs that could be crafted from funders' side of things, whether it's on-the-ground researchers that come from these communities that can be partners, for local governments to pursue this type of research. What we see is hopefully addressing this question by providing some examples and some resources to help all of those folks that say, I want to do this, but I don't have the infrastructure. Let's try to meet them where they are at. So those insights came directly from this process, and hopefully we'll be able to take this to the next generation. So on behalf of our full research team, Dr. Gilbert and myself, Camille Bousset, who's leading this effort, Carly and Quadro, our full research team at Brookings, thanks to all of you. Hopefully this has been a wonderful conversation that leads to some insights to push us beyond the 50% threshold for communities moving forward. Thank you very much.